Okay, so we'll be discussing today about the overview of our immunology. So, immunology is another branch of our medical science. We try to deal with the study of our immune system. So, the concept of our immunology came from the word immunization. When speak about the immunization, so immunization here is something that it's involve your infection with a particular organism and how your cells and all your immune system are able to fight in order for your body to recover it. So if you try to develop here a disease and eventually you try to recover, and that would lead to the production of your specific antibody against the specific antigen that try to cause here the infection. So that antibody is being produced here will serve as your protection. And therefore, once you try to recover from a disease, then you try to develop here your immune status that become your immunization. Okay, so individual here that has been infected by a disease would rarely try to contact the same disease again. Because again, if you try to consider here the principle of our immunity, so again, once you try to be infected with a particular disease and your body try to recover from that, you develop particular antibody. And that antibody become your protection against the reinfection. But it would say here rarely contacted the same disease again because that would be the principle. It's because here once you try to be infected and try to recover from a disease, the antibody that you produce here serve as your protection. But not that's not always the same, that's not always the case. It's because here there are some infection wherein you try to develop antibody, but then you can still be reinfected. Okay, so we have here the historical milestone with the development of immunology as our separate field of medical science. We started here in 430 BC when Thucydides here tried to note here about the incident of the plague which tried to infect here, especially on the Greece. Okay, try to note here that those patients has been infected would eventually try to recover, and therefore he tried to um, describe that one as having an immune status. So again, when we speak about immune status, they try to recover from a disease because eventually they have already developed an antibody, and therefore they could not be infected again. Okay, in 1000 AD, however, the Chinese people here tried to practice the so-called here the variolation process. But the variolation is the act of being exposing yourself to the pathogen. And with that, it would allow stimulation of our immune system and eventually try to develop an antibody. And therefore, it become able to serve you here with a protection against the infection. So what the Chinese people did here was, they tried to introduce primarily a scab or a lesion, a dried na lesion coming from a cowpox. Okay, so cowpox is a viral infection. So for those patients who has been infected by the cowpox, they try to get a dried lesion in that and they try to inhale. Of course, if you try to inhale, you are exposing yourself to an infection. It is up to your body to develop an antibody. But then again, your ability to develop here an antibody without causing a disease would be highly dependent on your immune system. So there are some, of course, this will not be successful here. There are some where they try to be simulated their immune system without acquiring a disease. But of course, some would try to develop a disease because of their inhalation of the cowpox lesion. Okay, so it's not a safe method for the exposing yourself. And exposing yourself to various pathogens, di ba? Like, just let your children, di ba, play para ma-expose sila and eventually they would able to, it will boost their immune system. So that's the principle of that. However, here in the 15th century, in the England, they tried to develop here a more another method of exposing themselves, not by inhalation, but by direct inoculation of the pathogen inside their body. And of course, again, there's a higher chance of developing a disease because of this one. Because when we talk about the principle of your vaccination, so vaccination, you are giving pathogen to the body of the individual just enough for the immune system to be stimulated. That's enough for the immune system here to be stimulated and allow the body to develop an antibody. But the amount of the inoculum or the organism should be not enough to cause a disease. So, ganun din, there's always a risk for this one because you are giving an organism to the body of the patients and it will have a greater tendency for them to develop a disease. Okay, in 1798, they tried to develop here a safer method of inoculation. Okay, where they try eventually leading them for the development of the cowpox vaccine against the smallpox. Remember here that the cowpox and smallpox are two different organisms, but they belong to the same family of the virus. They belong to your pox viridae. So notice here that okay, they try to develop a cowpox vaccine, but this vaccine is also against your smallpox. Because if you try to consider again, the development of our antibody is always very specific. Whatever the organism that try to cause an infection, you develop an antibody against that organisms or against that specific organism. It would not able to have a protection. It would not render you a protection against other organisms that is not the one causing the infection. But here, since they belong to the same family, you can be exposed to the cowpox, but you can develop an antibody, and that antibody can cross-react. We have here the term cross-reactivity. Okay, cross-reactivity. So when speak about the cross-reactivity, is the ability of your antibody to react to a different antigens. Because again, dapat specific ang ating antibody, whatever the one causing the disease, stimulation of your antibody, that antibody produced will only react on that. But our antibodies, there are some antibody wherein they can cross-react. They can cross-react with the different antigens. So although the other antigen here is not really the one stimulating its production, it can still react with another antigen or other antigen, provided that the one causing the stimulation of your antibody and another antigen, so itong antigen na to, nagkakause ng infection and is responsible for the production of that antibody, and you have another antigen na iba doon sa nag-stimulate ng production antibody. However, the antibody produced can still cross-react with that. So, kung ito antibody natin, you have your antigen, magkaibang antigen. So, for example, this is your antigen 1. This is the one that try to be responsible for the production of this antibody, and you have another antigen here, na iba dito. Again, usually your antibody produced here will try to react here with the one, specifically the one causing the infection. But if your antibody is capable of cross-reactivity, can cross-react against this antigen, specifically because it's the antigen that try to cause its production, and also try to react on this another antigen, provided these two antigen share some common determinants or antigenic epitope. So like in the case, for example, of your cowpox and smallpox, since they belong to the same family of the virus, your antibody produced on that can cross-react. Okay, and that's become here the principle of our vaccination. Okay, it was actually Edward Jenner, considered to be the father of the vaccination. So Edward Jenner tried to develop here a vaccine against your cowpox. Okay, against your smallpox from your cowpox lesion. Okay, so Edward Jenner actually tried to coin here the word vaccination from the word vaca or cow. It's because here Edward Jenner tried to notice among milkmaids. Pag sabi milkmaid, those are the one we try to, of course, collect the milk, di ba? So, na-notice niya na those milkmaids which has been exposed to the cowpox because they are, okay, dealing with the cow, di ba? So, the cow here has been infected by the cowpox. Okay, and then, upon exposure to the cowpox, we try to notice that those has been infected by the cowpox has developed here an antibody. And then ginawa niya, so tinest niya if that antibody can also be effective against the smallpox. So binigyan niya ng smallpox. Nung binigyan niya ng smallpox, for those has been infected by cowpox, na nakadevelop na sila ng antibody or they have already recovered from that smallpox or cowpox na infection, binigyan niya ng cowpox na disease or na virus, I mean. Okay, and then what happened on that is those mga binigyan niya ng smallpox, hindi sila nagkasakit. It means to say the antibody they try to produce against the cowpox could also provide them the protection against the smallpox. Ay, tama ba? Against the smallpox. And that you call it one the principle here of because of the cross-reactivity mechanism of that antibody. Okay, it was then 1980, the smallpox was first considered to be the first infectious disease here by the World Health Organization as the first to be eradicated worldwide because of the development of that vaccine. Then we have here 1880, Louis Pasteur tried to develop here the therapeutic vaccination by the process we call as your attenuation. Attenuation is a process whereby you try to weaken the virulence of your organisms. There are several methods here on how you're able to weaken the virulence of our organisms by attenuation process. You can have here your heat, you can also have your chemical, or even you can also have here your age culture. So pag having age culture, matagal na culture ng organism natin. Okay, so pag fresh ang culture natin ng organism natin, so that's highly virulent. But if you try to take that one culture of that organism for several days, and that become already less infectious, and that become attenuated. Okay, so Louis Pasteur actually studied here this phenomenon in the chicken cholera. So chicken cholera is infection, cholera, that try to cause here cholera among the chicken. So ginawa niya, kumuha siya, for those who's been chicken here which has been infected by the chicken cholera, kumuha siya ng specimen out of that, and eventually it tried to allow it to have a magiging age culture ito. And eventually, that age culture here would render the organism to be less virulent, magiging attenuated or weakened. And if you try to inject that one to another chicken, the chicken here will not get infected. But rather, that age culture having an attenuated na organism or weakened organisms would just stimulate the immune system of that chicken which has been infected by that to allow the immune system of that to be inoculated and allow it to be exposed lang, but not to get infected. And as a product of exposure, the chicken try to develop an antibody against that one. And currently, there are some vaccines that we are using which are attenuated vaccines, and that's the principle of that. And of course, rabies also has been studied by Louis Pasteur. And actually, Louis Pasteur is considered to be the father of immunology. Then we have here Bering and Kitasato try to propose the theory of humoral immunity. So when we speak about the humoral immunity, we're talking about your antibody production with involvement of our B lymphocyte. Okay, the next one we have here, Robert Cox in 1891 tried to display or tried to discover here the delayed type of your hypersensitivity reaction. So when speak about the delayed type hypersensitivity reaction is a type of our allergic reaction. So when we discuss about allergic reaction, there are actually 4 types of our allergic reaction or hypersensitivity reaction. Type 1 is mediated by the IgE, which is your antibody. A type 2 is mediated by your IgM and IgG. Type 3 is mediated by the IgM and IgG antibody. And type 4 is eventually mediated here by your sensitized T lymphocyte. And therefore, type 1, type 2, type 3 are all antibody mediated or humoral mediated type of your hypersensitivity reaction. The type 4, on the other hand, is considered to be your delayed type, and that one is your cell-mediated immunity, which is involving here not your antibody but your T lymphocytes. Therefore, we consider that one as your cell-mediated. Okay, and aside from that one, so Robert's cause is also known for its Cox postulate. That's what we have discussed already in your bacteriology. Then we have here in 1893, Mechnikov tried to observe your cellular process in the form of your phagocytosis. Mechnikov here tried to coin the term phagocytosis as a process whereby your cells try to engulf your pathogen that would eventually helping here to eliminate that pathogen inside our body. So Mechnikov here tried to observe this process of phagocytosis in the transparent starfish larvae. So transparent and therefore able to observe kung ano nangyari sa katawan niya. So ginawa niya, this starfish here is being given a foreign substance, a pathogen, and once inside the body already of the starfish, so may mga cells siya nakita na mga motile na cells where they try to surround that foreign substance na binigay sa starfish. And those mga motile na cells which try to surround the foreign substance was being given to the starfish, parang nilang kinakain. They are ready to eat that foreign pathogen. And therefore, Mechnikov described those mga motile which ready to eat those na mga the pathogen given to the starfish. So, para siyang i-try to coin, those are the phagocytes wherein they are engulfing, okay, or eating those pathogen inside the body. And therefore, doon nagsimula ang principle or process ng phagocytosis. Then we have here Jules They try also to be responsible here for the discovery of the complement system. So we'll be discussing, we have a separate topic for the complement system. The complement system help our body actually to remove the pathogen inside our body. In 1900s, Karl Landsteiner will try to discover here the ABO, blood group system, in our blood banking. Aside from that one, Karl Landsteiner also tried to conceptualize here the existence of your non-microbial way of your antibody production. Usually, usually our body try to develop your antibody against your pathogen, and those are microorganisms, like been exposed to the bacteria or viruses or even your parasites. So, those are your microbial, diba, organisms. And once you're exposed to that, your body can develop an antibody. But Karl Steiner proposed that there are also non-microbial substances that can induce antibody production. So, example for that, you have your allergens. So, allergens, so hindi naman siya microbial. So, it might be coming from the food, di ba? Okay, so it's non-microbial na organisms. And then, or substances, that can also induce antibody production. Okay, then we have here, 1900, we have also Paul Ehrlich's tried to conceptualize the concept of your antigen and antibody that leads here to our antibody formation theory. So we have another separate topic for that. Okay, the next one we have here, Kohler and Milstein try to discover here the first monoclonal antibody production through your hybridoma technology. So we have here monoclonal antibodies. So when we speak about the monoclonal antibody, it's an antibody that specifically react only with one specific antigen. And that one has been developed here by Kohler and Milstein through your hybridoma technology. So when we speak about hybridoma technology as a hybrid, they try to produce an antibody, a monoclonal antibody, by fusing your spleen cells and your myeloma cell. Myeloma cell here is a cancer cell, and therefore that would allows the production of your monoclonal antibody. And because ano siya, myeloma cell, ito galing siya kay myeloma cell, so it would have the property where it can produce at a faster rate. So mabilis siya dumami. And therefore, they can also have a greater production or yield of that monoclonal antibody because of that. Then, 2005, you have Ian Fraser here trying to develop the first vaccine against the human papilloma virus, which is the causative agent of the cervical cancer. As of today, there are many more development in terms of our immunology as a medical field of science. Okay, so we have here what is immunology. So immunology again came from the word immunity. So we speak about immunity, so you are immune, diba? So when something immune, you will not get infected. It's something that, okay, it would be providing you with a protection against an infection or a disease. So immunology is actually a complex study of our immune system, including here all the um, activators of our immune system or the players of our immune system, including here the cells, the molecules, the tissues, and different organs of our body, primarily to allow your body, your immune system, to identify the foreign antigen or the foreign substance that enters your body and eventually eliminating that pathogen inside your body because it's not part of our body. Okay, so we have here the functions of our immune system. So a healthy immune system should able to recognize between the self and the non-self. So pag sinabing self is part of your body, and normally dapat if it's the cells or the tissues part of your body, your immune system should not mount a harmful immune response. But if that one is non-part or non-self, being non-self is not part of your body, so we're talking about the harmful pathogen, so it should be eliminated in our body and should activate our immune system. Okay, and of course, here to defend our body against your non-self or a foreign antigen or the foreign substance that enter your body. Okay, so generally, what determines here eventually between self and non-self would be the cells of our immune system, including here the cellular components like our phagocytes. We have also here your mononuclear phagocytic system like your monocytes and macrophages. And we have also here your soluble factors like our complement. However, if your body could not recognize between the self and the non-self in the case of your immunotolerance, where your body could not identify that one is self, that one is non-self, where it tried to react on its with the self-antigen or self-tissues in our body that leads here to the so-called autoimmune disorders. So autoimmune disorders are a product here on which your body are producing autoreactive antibody, which try to react on your self-antigen, which try to destroy your self-antigens or self-tissues in your body. But of course, again here, if you have healthy immune system, that can recognize eventually between yourself and the non-self. Okay, now we go to your types of your immunity. So we can have your natural or the innate immunity, and we have also here your acquired or adaptive immunity. Okay, so we have here the difference between our natural or the innate immunity versus your acquired or your adaptive immunity. So natural or innate immunity would have the following characteristics. So this is a type of the immunity which is non-specific. So pag sinabing non-specific, it try to react or it try to eliminate the pathogen regardless of the pathogen that enters your body. Hindi siya nabimili. Okay, this is the type of immunity that is innate, meaning to say that's already present at birth. We try to acquire that one from our parents. Okay, acquired or your adaptive immunity on the other hand is specific type of your immunity. Pag sinabing specific, namimili siya kung alin lang ang kanyang tatanggalin, alin lang kanyang papatayin. That one requires a memory. An acquired or adaptive immunity usually is being activated on the second exposure or second encounter with the same antigen previously. Ito naman, usually, try to react even the first pa lang na encounter ng pathogen natin. But this one is being activated only on the second encounter, where for the first encounter, you try to develop a memory cells, and that memory cells will be the one going to eliminate that pathogens. And only that, and eventually that one is being activated only on the second encounter. Okay, first we discuss our natural immunity. So natural immunity included here are our first line of defense and our second line of defense. Our first line of defense, our external defense, and our second line of defense, our internal defenses. Okay, the first line of defense, we have here your, includes the following again. The first line of defense are your external defenses. So, mga barrier lang natin. It might be in the form of your physical barrier. Okay, physical barrier, like in the case of your intact skin. So, mas madali makapasok ang pathogen natin if you have sugat, di ba? Or open wound, ganon. So, we have also intact mucous membrane. Then, we have also here ciliated epitheliums. We're talking about your cilia and your nostril. Chemical barrier, on the other hand, includes here the chemical substance primarily present in our secretions. So we have here mga lysozyme, we have also secretory IgA. So example for that, we have your sebaceous gland or your sweat gland containing here the sebum, your ceruminous glands, the earwax. We have also salivary gland, the saliva contains here okay, lysozyme and secretory IgA, which are antimicrobial. Okay, your tears also contains here your chemical substance in the form of your lysozymes and secretory IgA, as well as our mother's milk also contains here the secretory IgA. And another one, we have here the pH of your digestive tract, and even here the pH of the vaginal tract or the female genital tract also provides a protection against the colonization of our pathogen. Okay, so we have here the different chemical substances that help here our body to fight against our pathogens. So first one, we have here lysozyme. So lysozyme is a chemical agent that is being found or produced, usually found here in our secretion like your saliva, your tears, your sweat. So basically, the lysozyme try to destroy the gram-positive cell wall. Then we have also here the pH of our stomach. Stomach here is usually less than or 1, a pH of 1. The pH of our stomach here is because of the hydrochloric acid produced by the parietal cells, and that one is highly toxic to our organisms. And of course, here the female genital tract or the vaginal tract would eventually would have the pH of less than 5. Okay, and you need to maintain that one. So primarily being maintained by your lactobacillus, diba? So apparently, if the pH, for example, here would be more than 5, it would trigger the colonization of your bacteria, like in the case of your Gardnerella vaginalis, and can result here to your bacterial vaginosis. Other chemical substance, we have your beta-lysine produced by our platelets that try to destroy both your gram-positive and gram-negative. Lactoferrin is another chemical substance. Actually, this is a component of the secondary granules of our neutrophil that can help also kill the organisms. So all of this one do have an antimicrobial property. The third component here of your first line of your defense would be your mechanical barrier. We speak about the mechanical barrier, that's anything that try to move, diba? Mechanical is nagmo-move. So for that, we have here the constant motion of the ciliated epithelium that try to filter the substances that try to enter our respiratory tract. We have also here peristaltic movement of your GI tract that try to propel the food that we are eating that would allow your undigested food and other pathogens or waste, toxic waste, to be eliminated in our gastrointestinal tract. Flushing of the urine, so also a way of removing the toxins or pathogens in our body by allowing to pass through along with the urine. And sneezing and coughing is also a way of removing here the pathogen. Another component of your innate or natural immunity would be your second line of defense. Our second line of defense are cellular defenses. So we're talking about the cells in our body that play an important role here in the elimination of your pathogens. So this includes here number one, we have your phagocytes. So this includes our granulocytes, including your neutrophil, basophil, eosinophil, and of course your monocyte macrophages plus our NK, natural killer, also part of our phagocytic system. Biochemical factors like your complement system. So complement system is a cascade of reaction where it tries to help our body to eliminate the pathogen, especially the antigen-antibody complex with your classical pathway of the complement activation. Complement system, there are three pathways. We have the classical pathway, we have also the alternative pathway, and you have your mannose binding lectin. We'll be discussing that one in our next mga succeeding lesson natin. Another one, we have your interferon. Interferon here is antiviral. So the alpha interferon is being produced by the leukocyte, the beta interferon is being produced here by your fibroblasts, and the gamma interferon produced by your lymphocytes. And the next one, we have your acute phase reactants. Acute phase reactants are mediators of our inflammatory reactions. So these are the different substances that try to increase if you have your inflammatory reactions. Sample for that, we have your C-reactive protein or the CRP. We have also here your fibrinogen. We have also your haptoglobin, and we have your ceruloplasmin. And another cellular defense, we have here the inflammatory reaction. So inflammatory reaction is just the manifestation of the body against your tissue antigens or your pathogens or tissue injury. So in the process where you have been having that tissue injury, so you were able to manifest here inflammatory actions. So you have your tissue damage, it will activate for the repair of that. Then we have your acute and chronic inflammation, depending on how, for example, gaano siya kalalim or gaano ka-severe ang manifestation ng tissue injury natin. It can last, kung medyo nahirapan ang body repair natin, it could eventually progress to become a chronic inflammation.